Hi, my name is Brian Blackwood. I'm the trauma medical director here at St. Anthony's Hospital. I was also the trauma surgeon on call this morning. We had the unfortunate events of receiving 3 patients who sustained gunshot wounds at Evergreen High School. I can tell you that our hospital did a tremendous job. We were able to take care of all 3 patients simultaneously with great staff. I will tell you, we had 1 patient who sustained non-life-threatening injuries and is in stable condition. Our other 2 patients sustained injuries that are leaving them critically ill at this point.
And we understand of the patients that you're treating here today, they were all shot, correct, doctor?
All 3 patients had gunshot wounds, correct.
Were any of the wounds self-inflicted?
I don't have the details about that.
Can you go into a little more detail, Dr. Blackwood, about how you responded and what kind of system was in place, and also what kind of care each patient received?
Sure. Unfortunately, traumatic injuries like this happen routinely here. Us being a level 1 trauma center, we take care of penetrating wounds all the time. So we usually have a little bit of a heads up. We're lucky when we do. About 5 to 10 minutes of prep time, hearing that patients were coming. We weren't sure exactly how many patients, so we prepared for multiple. And that allowed us to take care of the patients very quickly when they came in. We have a big team that responds to incidents like this. The whole hospital, kind of shifts gears and is ready to respond to the number of patients that present. So we have a great ED staff, a great trauma team, lots of providers who show up and are ready to take care of patients as soon as they arrive. In this case, we received 3 patients kind of simultaneously in order, a few minutes apart, and we had a team that was prepped and ready to go.
Did they all go into surgery right away? Can you tell us anything?
No.
All
All 3 patients came in to the emergency department first, where we could assess them and decide what they needed.
Are there any that had multiple gunshot wounds?
I don't want to go into the details of the patient's injuries at this time.
But you could say right now, doctor, at this point, do you believe all of these patients will recover at this point?
What I can say right now is that 1 patient has non-life-threatening injuries and is stable. The other 2 are critically injured.
Okay. I know you're limited.
I don't have the details on that information. The sheriff's office would.
We understand 1 is still in surgery at this very moment. The rest was a few minutes ago.
I believe he's out of surgery now, or just got out of surgery.
Okay. Your hospital actually underwent critical training just a few weeks ago. I would imagine that played a significant role in preparation for today. Can you talk about that?
Yeah, unfortunately, we never know when these events are going to happen. So at least a few times a year, we do training dedicated towards mass casualty incidents. But recently, we did one dedicated to a shooting incident where we received multiple patients that essentially received gunshot wounds. This was just a couple weeks ago. So that routine practice always allows us to be better prepped for when these things occur in real life. Unfortunately, they are going to happen at some point, and we want to be ready when they do.
So the families are here, I understand, of some of the students that came here. How do you personally prep yourself to talk to these families, to let them know how their children are doing?
It's really hard. I try and be straight into the point because I don't want to beat around the bush about what's going on. But, as a father myself, I can put myself in their shoes and kind of understand what they're going through. And I just try and be supportive and caring to them in this time. Unfortunately, these events don't just affect the patient, it affects the families, the friends of the patients, the school, the community, and we want to be mindful of all those people.
So you're the trauma director here, and you actually happen to be on call today.
I am.
What's going to happen from this point forward?
With regards to the patients?
To the patient care, and for maybe the care of the staff.
We're going to, as far as the patients, we're going to keep supporting them with whatever needs they have, in the coming days to weeks. As far as the staff, we try and be supportive of staff. An incident like this can be really stressful and can make the staff, sad and depressed. And so we want to support our staff as well. We've already had a few meetings afterwards to make sure the staff is doing okay. I'm sure we'll have more in the coming days.
Have you been in touch with every family member of the 3 victims or the 3 people here?
All family members have been updated.
Is it difficult in a situation like this where you have one perpetrator that you're treating, so to speak, and then victims, and how you treat those families and keeping them separate and that sort of thing? Are you also trained on that?
We do have training on how to deal with those things. Luckily, that's not something that we have to deal with often, but we work as a team to give the patients what they need and to be there for the family members.
How have you worked with the Sheriff's Department and the other responding agencies in a case like this?
So, the Sheriff's Department and all the agencies like EMS, fire, participate in these drills that we do. So, we have protocols aligned for how we communicate with each other and help control the scene, all these things. Luckily we've practiced for this, and the Sheriff Department has been a great partner today in helping us through this incident.
How long do you think the patients will be here?
Hard to say at this point.
I know you say you train on this, but it must be more difficult when the patients are juveniles, young people, kids. Talk about that and just the trauma of that for your staff and how you'll treat that.
It's always hard, honestly, with any age patient when something like this happens. It's unexpected. It's shocking to the patients, to their family members, to the community. We work really hard on just being supportive, not just medically, but in any way possible.
Have you worked on patients who've been involved in a school shooting before, Doctor?
We have.
Yeah.
Can you explain to viewers what a level 1 trauma center is and how it's different from other hospitals?
Sure. Basically, a level 1 trauma center is one that is equipped to taking care of the most severely injured trauma patients, the ones that have the most complex issues, the most complex needs. We go through lots of requirements to make sure we are up to speed and doing the things we need to do to be that level 1 trauma center. We work with both the state as well as the American College of Surgeons to make sure that our hospital is doing everything possible to be ready for events like this, or honestly any traumatic injuries.
Can you speak a little bit more about the 2 patients who are in critical care? Are you anticipating them continuing to be in that critical care for days, weeks, possibly? What do you know about them?
Right now, I don't really want to give any more details about their where they are right now as far as their situation.
I know your information is limited on what you can disclose about the patients, but can you say if they were they're awake right now, or if they were able to talk to mom and dad?
I don't want to go to any details about the patients currently.
Can you speak to the setting inside? We can see that there's a lot of officers here. Are law enforcement officers talking with patients? Are they filling the halls?
There's definitely more activity inside the hospital, and it's, I wouldn't say it's in any way disrupting the scenes. The law enforcement officers are being very mindful of the other patients we're taking care of inside, but they're being available as we need them.
How do you navigate when there are so many different agencies responding to something like this, and you're getting new information all the time? Does that impact your care and your procedures?
It doesn't impact our care. Basically, we're going to take care of patients as they arrive for whatever they need. It's good when we have extra communication with people outside the hospital about what's coming in, but we're going to take care of patients the best we can, no matter what. I have maybe one more question.
Have you spoken with police? Have you?
Our hospital has been communicating with the sheriff's office kind of consistently through this whole event.
And are you expecting police to stay here through the night?
That I'm not sure about.
Thank you so much.
Thank you, Doctor.
Thank you, guys.
So much.
Thank you.
Thank you.